Hi, my name is Dr. Kevin Rafferty. I'm an anaesthetic registrar currently working in Northern Ireland. I'd like to chat to you today about my invention that's available for sale, the Rafferty Distraction Headset. Day to day, I work as an anaesthetic registrar and I always strive to give the best anaesthetic possible. And these are the principles that I use to do that. I always want to increase safety. I want to reduce stress, pain, nausea, and post-operative drowsiness. If we can achieve that, we can work more efficiently and make our patients safer and happier. The Rafferty Distraction headset combines the anaesthetic face mask with a simple cardboard virtual reality headset into which any modern mobile phone can be attached onto, as you can see in the picture here. The alteration of this cardboard headset is that the bottom folds, allowing the Velcro strips to attach to the nose of the mask and to the lower part of the headset itself. It is hoped through initial familiarization and then distraction, the patient will be more happy and more at ease with the procedure, accepting it more easily. The mask can be used before the operation. If this is a regional anaesthetic, it can be used during the procedure, and then afterwards in recovery, it can be used to watch videos or play the little game. During the procedure, gases are delivered and measured as in any other anaesthetic mask, as the mask itself is unaltered, bar sticking some Velcro on the nose elements of the mask. Gas induction of anaesthesia can sometimes be very upsetting for the child, their parents, and the team in theatre. The Rafferty Distraction headset hopes to reduce this upset by distracting and making it a little bit of a game to go off to sleep with the gas induction. Using the bespoke VR app or using YouTube in VR mode, the child can either play the app going off to sleep or watch their favorite cartoon or video. The Rafferty Distraction headset has its own bespoke app, the virtual reality picnic party app. This is a virtual reality app for Android phones that can be used pre-operatively in the clinic initially, or the pre-operative assessment room, and also then used at the time of induction, gas induction of anaesthesia. There is an initial game where the child blows out candles on a cake in a forest environment, as you can see in the little picture. And then, as the picture shows here on the screen, there's a balloon game that whenever the child's in theatre, as the balloon on the anaesthetic machine is green, the child is blowing up this green balloon in virtual reality. The app is guided in that it has my voice chatting through each little bit, and you can use that, or you can just use the pictorial representation that you see there, but there is music and there is guidance in the app. A typical patient journey using the Rafferty Distraction headset would be in the clinic. The nurse or the doctor, whether it be the surgeon or the dentist, would give the child the mask and the headset as one piece and would encourage the child to place the mask and the headset on to then watch either a YouTube video in VR or to play the blowing out the candles game on the VR picnic party app. Then that mask would be taken away from the child and the headset altogether taken away from the child, and then it would be seen as a coveted item for them to receive back again once they're coming to theatre and going to go off to sleep. So hopefully they'd be looking forward to receiving this game back again, and that would be reintroduced then at the time of gas induction, where they'd play a slightly different game of blowing up the balloon, or they could watch Pokemon or any other video that they wished to watch. After the procedure is complete, then the headset can be used in recovery to watch music or video there. So we spoke about any gas induction, especially in our paediatric population, and I think that the low-hanging fruit for this project, this product, would be those children with what I would describe as phone-focused autism, the child that doesn't really wish to communicate but is more than happy to watch their phone or watch their favorite show on their phone or favorite little game. This can be used with that the mask and the phone become the one thing, and if they want to see the phone, that the mask has to be on their face. And I think that speaking to most anaesthetic colleagues, they'd agree that as soon as the mask is on the child's face, it's a big step in the right direction for completing a successful gas induction. The Rafferty distraction headset can also be used in CT scanners as a distraction during the scan. Any oxygen or nebulized therapies that a child may have, so any of the broncholytic channels you may see in the emergency department, or the asthmatics as well on the ward or in the emergency department, would be more at ease with having the video or app on their phone being played whenever this treatment is being given. We're really just taking away the whole clinical environment from the child, allowing them to relax and accept the nebulized treatment, whether that's oxygen or a nebulized medication. It could also be used during dental procedures, as you can see here, using a nasal mask. Also could be used for any painful or unpleasant procedures, such as IV cannulation, vaccinations, or other dental procedures. Adult uses. All good paediatric practice bleeds into the adult world, and anything that we've discussed so far could be used in an adult population as well. I think thinking about the adult journey, we can see the headset more as an advertisement. Could be sent out to a patient, linking to a YouTube VR video or standard video. You can have a tour of the hospital, have a tour of your facilities, meet your surgeon, meet your anaesthetist in virtual reality, and use our headset as a vehicle for that. You can have a VR experience of the day of surgery, what to bring, where to park, who to bring with you, what to bring with you, what to expect from that day. If your procedure is under regional anaesthesia, then you could use the headset during the procedure and have enhanced monitoring via the anaesthetic face mask, reducing the need for sedation and therefore reducing your day patient stay. So hopefully you could do more work in a given day if you had to reduce the amount of sedation required for your patients. Also, it can be still used for music and video in recovery. Virtual reality has an evolving role in obstetric practice. Since the coronavirus pandemic, tours of the obstetric units have stopped. The Rafferty distraction headset could be used as a vehicle for giving obstetric tours in virtual reality. Also, virtual reality has been used in labour and augmented with Entonox using the Rafferty distraction headset with the mask integration. It would be possible to use Entonox and also avail of the benefits of distraction, meditation and relaxation that would be offered through virtual reality. I would like to thank the team at Henleys Medical Supplies, who are the sole retailers of the Rafferty distraction headset. The headset retails at $9.95 inclusive of VAT, and you can purchase it through their website at henleysmed.com. If you require any more information or images of the product, please go to my own site at www.raffertydistractionheadset.com. This is the web page on Henleys Medical Supplies website that has the Rafferty virtual reality distraction headset on it with all the information required for you to make your purchase. Thank you so much for listening to this presentation, and I'm more than happy to answer any comments or questions. And if you'd wish me to present to your institution or have a conversation with anyone directly, I'm more than happy to answer those calls. You can contact me on LinkedIn or through my website. Thank you.